Hi, I'm Gretchen Day, and I'm part of the American Indian Alaska Native Clinical Research Program, and I'm a biostatistician at the Alaska Native Tribal Health Consortium. And for those of you who don't know, the Alaska Native Tribal Health Consortium provides health services, including research for Alaska Native people throughout Alaska. And as part of the AIA and CTRP, we have a lot of resources that we can provide to investigators doing any kind of health research in Alaska. And so the research design, epidemiology, and biostats team has a number of members. Jacques is also a member of this team, as well as the other program he's going to talk about. But we have biostatisticians, epidemiologists, medical anthropologists, and data management, which is primarily REDCap. We also have a universal healthcare system with electronic medical records, electronic dental records for research that can be used for research. We have the Alaska Native Specimen Archive, and we have a number of health registries, the Alaska Native Tumor Registry, the Diabetes Registry. So working with our program, investigators can have access to a lot of resources. As the CTRP for the last 4 or 5 years, we've given grants to investigators. We're done with that for this cycle, but in case you're wondering what could you get from us, we found that more than half of our investigators came to us to focus their research questions, to define their aims, to generate hypotheses, to discuss community engagement, to connect with investigators and find collaborators and resources, to get help with proposal writing or conceptual framework, and assist with their timeline development. So there's a number of pieces we could help with. Also, each month, many of you may have seen these already, we have brown bags. The research brown bags are informative sessions designed to make you aware of health research involving Alaska Native and American Indian people. Those are the second Wednesday of each month from noon to 1, and I've given you the Zoom meeting ID and password. These are open to everyone. You can also email me, and I'll give you my email in a second, and I'll put you on the invitation list. We also have a methods brown bag series, which are educational how-to series for researchers. And those are the last Tuesday of each month, noon to 1, and there's the information for that. And if you want to know more about our services, please email me or Dr. Tim Thomas, who's the director of the Research Design, Epidemiology, and Biostats core of this program. And that's all for me.
Thanks, Gretchen. All right, we have Jacques. Do you have an additional session to contribute on this one? Okay, great. You're up.
Yeah, I don't have a PowerPoint. I don't have any slides, but I can just maybe add on to what Gretchen was saying. So I'm Jacques Phillip, and I'm research assistant professor at UAF. I'm a biostatistician for the AIA and CTRP that Gretchen just talked about, but also for the CTRIN, Mountain West CTRIN, which is another clinical translational research program, which involves 7 states, 7 Western states. So one thing in general that I would like to say is that as a biostatistician at UAF, I'm primarily available for people who want to prepare a proposal. That is the main goal of actually both CTRs, that we're providing consulting for investigators who want to submit a pilot project proposal. This being said, we can also help investigators on other items, but the primary goal is for people who want to submit a proposal. And the two CTRs have different ways of doing this. So I'm going to talk about the CTR-IN now because that's the focus. The CTR-IN has many universities, I was saying 7 states, and each state has 2 or 3 universities. So the way they do it is that each institution has to pre-select investigators for the pilots. And so we can actually consult at that stage before, and the way they do it is the investigators have to write, I think it's only 1 page or maybe 2 pages white paper. And, you know, routinely we will go through the white paper for study design and data analysis section mostly, but sometimes for other aspects for new investigators, and it will help them actually write their proposal. We also consult at the time of the proposal itself. So that's the main goal. An important thing to know, especially for the CTR-IN, like I was saying, this is 7 states and many institutions. And if, for example, somebody asks me for a consultation on a topic that I don't feel comfortable with, we have a system of distribution of expertise throughout those 7 states. So in particular, you were talking about bioinformatics before. I know INBRE has its own bioinformatics course, so it might not be, you know, necessary. But if it was necessary, I can refer an investigators to the bioinformatics people in the CTR-IN, which is mostly the University of Nevada, Reno. And this way we can collaborate in a much broader level. The other thing that the CTR-IN has available, and we're working on this, it's not completed yet, but some modules are available. It is some online resources in the CTR-IN portal. And this is different. This is not mostly for or just for investigators who want to submit a pilot. This is for any investigators at the member institutions. So all you have to do to access these resources is ask or register on the CTR-IN portal, and then you will have access. And these resources cover biostatistics, bioinformatics, epidemiology, and data management. So these are the 4 topics. And like I said, there will be more, but you're welcome to ask, and I can get you, I don't have it here, the web address on top of my head, but it's easy to find. Contact me if you need it. And all you have to do is register on the portal, and you can access those resources. So in the last couple of minutes, I guess, and I'm not sure, you can tell me if I'm supposed to talk about this, but I just realized this morning that there is another core in those 2 CTRs, which is the community engagement core. And there's sometimes some overlap with the biostats and study design, especially because both people at the NTHC and myself, you know, have had our own community-based participatory research experience. So this is a really important resource. If any of you needs to get in contact with communities, and when I say communities, that's a broad term. So it could be like Alaska Native communities, for example, a village, or even in Anchorage, you know, you need, or health, Alaska Native Health Corporation. So there is a core for that, and I don't have time to detail all of it, but just know that you can ask the CTR, and you will be put in contact with somebody from the CO core. But it can also be a clinician community. And we don't have a whole lot of those contacts yet, although NTHC has quite a bit, but the CTR-IN has also a community engagement core, and they have 2 medical schools, for example, in Nevada. So they can put you in contact with clinicians eventually, if this is something you need. But again, this is mostly for people who want to submit a pilot for one of those CTRs. And